We are studying about the infective endocarditis. Here we are going to know the overview of infective endocarditis. Infective endocarditis means infection of endocardium. Okay, where this infection also involves the heart valves. Means the infection also occurs in the heart valves also. Usually, infective endocarditis occurs among the people who are above the 60 years of age or who are above who are more older. So these are the prevalence of infective endocarditis. People who are above 60 years are usually have usually get the infection with the some bacteria and get infection in the endocardium of the heart. Basically, this is more common in male and can be diagnosed, can be dangerous or can be life-threatening if untreated. So what we consider that if there is a infective endocarditis, so if it is not treated, so it may be the dangerous or life-threatening to a person. And because of that, we require urgent medical attention and this requires a series of lab tests or imaging methods so that we can diagnose the the disorder. So imaging test and laboratory test will help in the diagnosis of the infective endocarditis. These are the symptoms which are available. Symptoms depends on disease causing organism. Also, it can vary from person to person. So, what organism has caused the disease, or what to who has got this infection? So it depends. The symptoms depends accordingly. So the common symptoms usually recorded for the infective endocarditis are fever, shortness of breath, muscle and joint ache, swollen feet, January lesion, Osler nodes, and Patachi. So there are three the specific symptoms are given. January lesion, which is we can see here that this is a erythematous hemorrhagic spots, also known as red spot, which usually occurs in the soles and palms. So here palms has got the red spot. Similarly, there is Osler node. So usually appear in the hands and feet. So this is a red painful raised lesion, and there is a patachi where there is a purple or red spot in the white of the eyes, skin, and inside of the mouth. So here we can see the patachi, or even sometimes purpura also. So large spot or the small spot, red spot can be seen in the eye, skin, inside the mouth, on the leg, on the body parts. Can you hear my voice? Hello,
Yes,
students.
sir. Yes, sir.
Okay.
Yes, so
Okay, so these are the what another images with the symptoms we can see. Osler nodes which is what is a painful. January lesion is a non-painful. So here we see the erythematous macules or spot on the palm. Okay, or can also be seen in the soles of the feet. So similar spot, red spot can be there, or it can be there the oscular nodes, which is painful erythematous nodules, means red spot we can see, which is painful, which is raised nodule, and we can see this on the even on the fingertips or the toe tips also, and we can see the red spot where there is a red color hemorrhages in the retina. So these are the what the spots we can see in the retina also. So these are the common findings, common signs, symptoms usually you can see in the patient suffering from infective endocarditis. So what are the causes that causes infective endocarditis? So mainly the bacteria, because it is an infection by the bacteria. Okay, so bacteria which are present in the parts of the body such as mouth, throat, and the gut. So they are responsible for causing endocarditis. Okay, how they cause endocarditis? how these bacteria of mouth, throat, and gut can cause endocarditis. So the reason is when they migrate into bloodstream, then they go to the endocardium, and then there they causes infection. So that is the reason behind endocarditis. Okay, the major reason. There are some other reasons also, uh, where bacteria first of all get into the bloodstream. Okay, and the procedure that we do through which the bacteria get into the bloodstream are like catheterization. Catheterization is a process where we insert catheter. There are some catheter we insert in the urethra. Okay, so ureter catheter are also available. So through that also the bacteria enter into the inside of the body, and through inner parts they enter into the bloodstream. Similarly, poor oral hygiene, gum disease, sexually transmitted disease is using a contaminated needle. Like when you go for the taking injection or doing tattoos or piercing process. So in such process also the bacteria which are present on the needle get into the bloodstream. When we get artificial heart valves, okay, and when there is intravenous drug abuse, so the addicted person reuse the syringe and needle many times, and also they share the syringe and needles with other person. So there is a what the chances of infection, and the bacteria directly get into the bloodstream. A previous infection of endocarditis. So this is what the reinfection of endocarditis process. And the lastly, when there is a damaged heart valves. So in such cases also, the damaged heart valves, the patient are highly vulnerable, susceptible for endocarditis. So these are the causes we have studied. Here in the image, you can see that aortic valve. Uh, this is the aortic valve. You can see in the image. This aortic valve, how it looks like normally actually, but when there is a bacteria, when it get into the blood, so through bloodstream, it entered into the aortic valve, and then it grow and causes the bacterial endocarditis. So this is what we can see when the patient suffer from endocarditis. So endocardium get affected, and the valves are also affected. Prevention. How can we prevent the endocarditis like condition? So the brushing and flushing of the teeth regularly is one of the way that helps to maintain the hygiene. Then avoid non-sterile procedure like pursing and toes. When you go for pursing and toes process, so tattooing process there when they use non-sterile needle to do the pursing and make tattoo. So in such cases, the bacteria which is present in the needle may go directly into the bloodstream and can cause infection in the cardiac. Antibiotics can be given to high-risk patients. So here, this is suggested to take antibiotic so that the bacteria if it is in the body, blood, so it can be killed by the antibiotics. So in such cases, the valves can be damaged. With the help of infection can be prevented. What are the diagnosis tests which are available to diagnose endocarditis? So diagnostic tests are basically the lab test, the blood test, what we say, where we can do some microbiological test on the blood sample to check there is infection of the blood, or if there is a bacteria or fungi present in the bloodstream. We can go for the imaging procedure where CT scan, MRI, electrocardiogram, X-ray, this we can do so that we can check either the infection has a spread to lungs, brain, or other areas, or we can check the enlargement of the heart through the X-ray procedure. Treatment is done through nutrition, medication. Procedures are like open heart surgery. Medication we can take antibiotics to reduce infection, and these days instead of open heart surgery, we can also go for the minimum invasive procedures to so that the heart valves which are affected can be I think replaced also. Nutrition is suggested to to advise the patient to take some food which are rich in iron, vitamin B12, and also the food which are rich in antioxidant, so that these foods can increase the immunity of the person, so that the person can immunity can fight against the bacteria, and the patient can be prevented from endocarditis. So we have come to the end of the slide. Now, coming to the discussion, if you have any question, please ask me. Question, please.